I'm Dr. Magda El-Diwani, Assistant Professor in the Department of Restorative Dentistry and Biomaterials at the University of Texas Dental Branch. In the past, dentistry stressed restoring function and pain relief more than a nice smile. In the 21st century, with the advent of fluorides and prevention, we are now able to focus on aesthetics and the smile. In a world of extreme makeovers, aesthetics has come to the forefront in dentistry. Today, the general public is more informed, and they come to us demanding whiter teeth and a brighter smile. We can now make customized bleaching trays that deliver bleaching material precisely where it needs to be. This enhances the results and accelerates treatment. In this presentation, I want to demonstrate how to fabricate custom trays for home bleaching. The first step is to make an alginate impression for the maxillary and mandibular arches. Pour the impression in stone soon after it is made to ensure accuracy. Be sure to leave the palate and tongue areas without stone. Allow the models to set, then separate the model from the impression. Trim the base parallel to the occlusal plane and about 10 mm from the gingival margin. Trim any ragged stone from the palate and tongue areas. Inspect the model for any small bubbles. If you find any bubbles, remove them with a lab knife. Allow the model to dry. With the brush tip, apply 0.5 mm thickness of the blockout material onto the labial and buccal surfaces of the teeth to be bleached. Stay 1.5 mm away from the gum line to avoid opening of the margins during biting and to avoid impinging on the soft tissue. Do not extend the blockout material to the occlusal or incisal surfaces. Cure the blockout material for 2 minutes in a triad visible light curing system or any similar unit, or you can use a handheld curing light to cure for 20 to 40 seconds per tooth. Wipe off the oxygen inhibiting layer with an alcohol swab. Lubricate the model with silicone lubricant. Place the tray material on the vacuum forming machine and secure it in place. Raise the tray assembly to full height and place the model in the center of the platform. Turn on the heating element. As the material heats, watch for it to sag. The tray material is heated and ready when it sags 1.5 to 2 inches. Turn on the vacuum and quickly lower the tray assembly. Keep the vacuum running for 30 seconds. While the material is still warm, you can wet your fingers and adapt the margins. Wait until the model cools off completely. Then trim the bulk of the material. Separate the tray from the model and use small sharp scissors to scallop around the buccal embrasures. Allow a 0.5 mm gap around the gingival margin to minimize or prevent any soft tissue irritation when the bleaching material is placed in the tray. Trim the palatal and lingual sides of the tray straight across and a few millimeters from the gingival margin. Scalloping is generally not necessary on the lingual side because the bleaching material will be applied on the buccal surface. The incisal papilla could be relieved in order to prevent soreness. Place the trim tray on the model and check for fit and extension. If necessary, you can readapt the margin by applying low flame heat to the margins and holding the periphery for 3 seconds with a water-moist finger. As a final step, you should disinfect the tray with antibacterial solution. You can store it on the model until the delivery appointment. I hope this presentation has helped you better understand the process for making customized bleaching trays. As you can see, it is not that difficult, and I hope it will help your patients in the quest for the perfect smile.